Hi there. My name is Cruz. I'm an MD physician. I've been practicing medicine for 30 years, the last 20 years dedicated to regenerative and integrative medicine. I work at Kentuckiana Neurological Recovery Center and Kentuckiana Integrative Medicine, where I'm the medical director. We focus on regenerative medicine therapies and neurological injuries. If you're new to the channel, we welcome your questions and we'll try to answer them as quickly as possible. Today the focus is on stroke and recognizing stroke symptoms. And there's a very helpful mnemonic that was developed by Dr. Rajiv Narula, and it's called Be Fast. And we want people to be fast heroes. And be fast is a very elegant mnemonic. B stands for balance. So if you see a patient or a person rather that has imbalance, you might consider that they're having a stroke. B stands for balance. E stands for eyes. If they're having visual loss or visual disturbance or a droopy eye, once again suspect stroke. Fast, F stands for face. Do they have a facial droop? A stands for arm weakness or leg weakness. S stands for slurred speech or discontinuous speech or illogical speech. And T stands for time. Time is of the essence. So if any patient or person that you encounter has any of those symptoms, you want to call 911 immediately so they can get to the hospital and receive stroke therapy as quickly as possible. They only have a 3-hour window to receive the quote clot buster medicine to dissolve the clot in their brain. And after that, the only therapies in limited cases are what's called a thrombectomy, where a catheter is inserted, and in certain instances, an interventional radiologist can grab the clot that's causing the stroke symptoms. But that doesn't work in all stroke cases. It requires that the clot be in a certain part of the brain and a certain part of the blood vessels in the brain. So time is of the essence. And after that 3-hour window, patients cannot receive the clot buster because their risk of increased bleeding into the brain goes up exponentially. So become a Be Fast hero. Again, be fast. Is there a balance problem? Is there a visual problem for the eye? And E. F for face, facial drooping. A for arm weakness or leg weakness. S for speech slurred or disjointed. And T for time. Call the 911 as quickly as possible. So we hope you will become a Be Fast hero and rescue someone if they're ever developing those symptoms. And we welcome your questions if you're new to the channel, and we'll try to answer them as quickly as possible. Thank you.